Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is, what is the relationship between psychopathy and intermittent explosive disorder? Now, to help answer this question about psychopathy and intermittent explosive disorder, I'm using an article that was published in 2014 by Coccaro and colleagues, and I'll put the reference for that article in the description for this video. So I'm first going to talk about intermittent explosive disorder, and then we'll take a look at psychopathy, and then talk about the relationship between these two constructs. So when we talk about intermittent explosive disorder, we're talking about a mental disorder listed in the Diagnostic and Statistical Manual, the DSM. And we see when we first look at this diagnosis that it involves recurrent behavioral outbursts that represent a failure to control aggressive impulses. But this can be met in a few different ways. So an individual can have either of the following two areas to satisfy that criterion. The first would be verbal aggression or physical aggression, and I'll give some more detail behind this. And the second is just a type of physical aggression. So let's go back to the first. Here we see verbal aggression, so this would be temper tantrums, tirades, verbal arguments, or fights, or physical aggression, and this would be physical aggression against property, animals, or individuals. However, with this particular type of physical aggression, no destruction or damage can happen to property, and no injury can happen to animals or individuals. Also with this criterion, we would see this twice weekly for at least 3 months. So we can think of this as low intensity and high frequency. So again, that's one way to meet that recurrent behavioral outbursts piece. So the second way is a certain type of physical aggression. And this would be physical aggression that occurs 3 times in a 12-month period, and it would involve destruction or damage to property or injury to animals or individuals. So this would be considered a high-intensity, low-frequency option. Now there are other criteria to meet as well. We see that these recurrent behavioral outbursts must be out of proportion to provocation or the stressors. We see they cannot be premeditated, so they have to be impulsive or anger-based. We also see that there must be distress or impairment, and they can't be better explained by another mental disorder, including antisocial personality disorder, which of course has a relationship to psychopathy. So what's important to note here is that intermittent explosive disorder can still be comorbid with antisocial personality disorder. You just can't have a situation here where the recurrent behavioral outbursts are better explained by antisocial personality disorder. In that case, there would be no diagnosis of intermittent explosive disorder. Rather, we would just see a diagnosis of antisocial personality disorder assigned. So now moving on to the construct of psychopathy. Now, I've covered psychopathy in prior videos, and I've mentioned there are a lot of different ways that psychopathy is divided up. There are 2-factor constructs, 3-factor constructs, and even some 4-factor constructs of psychopathy. But by far the most popular conceptualization would involve 2 factors. And here we see primary psychopathy, which we could think of as callous, unemotional, which would have characteristics like lack of empathy, remorse, guilt, as well as superficial charm, deceitfulness, and grandiosity. And then we have secondary psychopathy, which we could also think of as the social deviant factor. And here we have antisocial behavior, impulsivity, irresponsibility, lack of clear goals, and lack of behavioral controls. With this particular study, they used callous, unemotional, and social deviant as the 2 factors. But again, those mostly align with how we think of primary and secondary psychopathy. So in this study, we see that individuals were divided into certain groups. We had different participant groups here. Individuals with intermittent explosive disorder, individuals that they referred to as psychiatric controls. So they had at least one mental disorder, but not intermittent explosive disorder. And we also saw another group they referred to as healthy controls, and these individuals did not have any diagnosis of mental disorders. So we see that they measured a lot of constructs across these 3 groups, including psychopathy, aggression, impulsivity, and anger. So what were the results from this study? Well, they found that about 6% of the individuals who had intermittent explosive disorder fell into the highly likely to have psychopathy group. So there was a high likelihood that 6% of those individuals actually had psychopathy. Now this is 5 times greater than what we see in community samples, but it is too low to say that one construct explains the other. So we can't say that intermittent explosive disorder is explained by psychopathy or that psychopathy is explained by intermittent explosive disorder. So really this is a fairly small percentage of the participants that had this psychopathic personality. We also see here that when individuals with intermittent explosive disorder did have psychopathic personality, it was much more likely that they were in the social deviant type than in the callous unemotional type. So much more likely to have secondary psychopathy as opposed to primary psychopathy. We also see here that individuals with intermittent explosive disorder without psychopathic personality had higher levels of trait aggression and trait anger when compared to the psychiatric controls with psychopathic personality. So we see here that psychopathy does not explain anger and aggression in intermittent explosive disorder. Now, as far as impulsivity, we see the same levels of impulsivity here for intermittent explosive disorder and psychopathic personality. So the impulsivity piece really didn't break toward one or the other. It was level across both. So what can we learn from this study? Well, we see that anger and aggression have a strong relationship to intermittent explosive disorder, and really this should not be at all surprising. What's probably a little more surprising would be that psychopathy only had a modest relationship to intermittent explosive disorder, and when we did see a relationship between these two constructs, it was much more likely to involve the social deviant subtype of psychopathy than the callous unemotional subtype. So this type of study gives us a lot more information about the relationship between these two constructs. I think a lot of times when we first look at intermittent explosive disorder and we look at the different symptoms and the symptom criteria and we look at psychopathy, there's this tendency to say there must be a lot of overlap between these constructs. And really there's not much overlap at all. And if you only look at the callous unemotional factor, the primary psychopathy, it's even less overlap than we see with secondary psychopathy. So again, this is an interesting study that gives us a better understanding of these constructs and their relationship to one another. I hope you found this description of psychopathy and intermittent explosive disorder to be interesting. Thanks for watching.